Hello, in this video, I'm going to be talking about rare side effects, particularly the experience of having a rare side effect. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. Rare side effects. If you have an unusual side effect or a very unusual side effect, if it's a side effect that occurs in fewer than 1 in 100 people, this is called a rare side effect. The experience of having a rare side effect, though, although it's really just a statistical phenomenon, is that you may feel like you were not diagnosed in time. You may feel that your side effect is being dismissed. You may be told in ways, subtly or not so subtly, that you're imagining it. If you're an individual person, that's all very well and good, but it is occurring in 100% of your body, or the body of the person you love. So statistics are all fine, but if you're the person experiencing the event, it's not like 1% of you gets the side effect. If you're looking, we've had comments about radiation and chemotherapy-induced pneumonitis or inflammation of the lung. It doesn't matter that out of 100 people, you're the only one that got it. What matters is that you got it. So there are a few difficult things to think about in terms of when a physician talks to you about what you might expect to experience, or a nurse, nurse practitioner, physician assistant, or pharmacist. They're going to talk about the most common and expected things, hot flashes, for example, or nausea, or fatigue, or rash, or kidney or liver problems. They'll talk to you about common, less common, really uncommon, and then those rare side effects. It is really hard for people to absorb all of that information. And so when people start on treatment, no matter what kind of treatment it is, they're often given a consent form that has more information. And we do try to write these at a 6th grade reading level so that they're accessible to the majority of people. But there's a lot of jargon that we can't help but avoid sometimes. A low white cell count, for example, might not make any sense to somebody. Or inflammation of the lung, you might think, that sounds okay, and we'll tell you it's usually reversible because it is. But when you go home with that consent form, your brain has to filter out that huge quantity of information. Similarly, physicians are going to be able to tell you what they see in practice. So there's the clinical trial knowledge, and that information will go in the consent form. A physician can also start to understand how people feel on this treatment. And they're going to notice the things that are more common, those nausea and vomiting side effects, fatigue, rash, problems with get up and go in the morning, or kidney problems, or low white cell counts. If they don't see a rare side effect, it's not going to be top of mind for them either. The other thing is that it can take a long time for clinical trials to report a rare side effect. If we say that it's not related to the treatment because we've never seen it before, or it wasn't expected, or it wasn't, based on the chemical structure of the drug, you can see how it can take a while for that to become more prominent. Similarly, and this is interesting, if a physician has seen 2 people with a rare side effect, they're going to start to lead with that side effect. So this is kind of the opposite. Let's say 2 people out of 1,000 get a side effect, but that oncologist or radiation oncologist happened to see it in their last 2 people. Something called availability bias will make them talk about that first. So I'm going to use a ridiculous example. If I had 2 people in a row develop purple and green spots so that they look like a cartoon dinosaur, but 2 people in a row got it, that's the first thing that's going to come out of my mouth when I'm telling you about the side effects of the drug. So it's important to understand these biases, like the availability bias, what we've seen most recently, and how that plays out in the informed consent process. Clinical trials give us the source of data on how common side effects are. when somebody's on a clinical trial, we collect data on any organ system, even if we didn't expect it to be a side effect of the drug. So we have multiple organ systems and we have multiple side effects that we collect. Some side effects are expected when the trial is started based on what we know about the medication or medications, and some side effects can be a surprise. And we see those only because of close monitoring of patients. The earlier stage phase 1 and phase 2 studies enroll smaller numbers of patients. So we don't see these rare side effects until, number one, many years later sometimes, and also until we've had thousands and thousands of patients enrolled, or at least several hundred, for us to be able to attribute a side effect to treatment or not, and also to say, under safety regulations, whether it was expected or not. So I just want to make a note about language. When we talk about a rare side effect, what we mean, what we're referring to, is the proportion of people on the clinical trial, or in our experience, or in reports of side effects or toxic events, that the proportion of people who had that side effect. The downside of that word is that when patients hear it, they may hear, I don't believe you. I don't believe you're having this side effect, or no, it's not related to the treatment. And that may actually be what the doctor says. If they're pretty confident it's not from the treatment and they say, I've never seen that before, it's important to take that with a grain of salt, that they just may not have seen that before. They're not saying, I don't believe you. They also may not know any particular ways of treating that unusual or rare side effect. And sometimes when doctors feel that lack of certainty on how to manage somebody, their better nature doesn't come forward. This is not to make you not trust your doctor, but to understand a little bit about the cognitive processes that happen. I've covered a lot in this video. It was prompted by people commenting on our other videos about toxic effects they've had or their loved ones have had, sometimes really serious side effects, albeit rare. And we just wanted to point out that rare doesn't mean it doesn't matter. Thank you so much for watching, and we'll see you next time.